sepsis. You've probably heard the word, right? But what is it really? Well, it's not just a bad infection. It's something far more sinister. It's the body basically declaring war on itself, a hidden killer and one of the absolute biggest challenges in medicine today. So let's get into it. And to really grasp just how big a deal this is, just look at this number, 11 million. That's how many deaths were linked to sepsis worldwide in just 1 year, 2017. I mean, that's a staggering toll. It's not just a medical problem, it's a full-blown global health crisis. Okay, so what is it officially? This definition is absolutely key. Sepsis is not the infection. Let me say that again. It is not the infection itself. It's the body's completely haywire, over-the-top reaction to infection. Think of it this way. Your immune system, which is supposed to be your greatest defender, well, it goes rogue. It becomes the attacker, and that friendly fire leads to catastrophic organ damage. All right, so here's what we're going to cover. We'll look at what sparks this whole firestorm, then dive into the body's civil war. We'll touch on the global crisis, the absolute race against time to treat it, and finally, what happens after, and what the future looks like. First up, the spark and the firestorm. So how does something so common, like a simple infection that our bodies fight off all the time, suddenly escalate into a life or death emergency? This really lays it out perfectly. On one side, you've got a normal, uncomplicated infection. Your immune system is like a disciplined special forces team. It goes in, neutralizes the target, the pathogen, and gets out. Green. But on the other side, that's sepsis. That same special forces team just goes completely berserk, causing massive collateral damage. Friendly fire that hits your own tissues and organs. And when that out-of-control response hits its peak, it can lead to something called septic shock. This is the absolute worst-case scenario. We're talking profound problems with your circulation, right down to the cellular level. And the mortality risk, it just skyrockets, jumping to over 40%. It's incredibly dangerous. Okay, so let's zoom in on that internal battle. What is actually going on biologically when the body wages this civil war against itself? This diagram does a great job of showing the domino effect. So it all kicks off when your immune cells spot a pathogen. That recognition triggers this massive release of chemical signals. You might have heard it called a cytokine storm. This storm causes widespread inflammation and cell injury. But here's the crazy part. That injury itself sends out more danger signals, which creates this vicious runaway feedback loop. The chaos just keeps amplifying itself until eventually entire organ systems begin to shut down. And the downstream effects of this immune firestorm are just devastating. It disrupts basically everything. Blood flow goes haywire, tiny dangerous blood clots can start forming all over. And if you zoom in even further to the cellular level, the mitochondria, the power plants of our cells, they start to fail. The body's entire energy grid and hormonal system is just thrown into chaos. And the end result? It's a war on multiple fronts, all inside your own body. See, sepsis isn't a localized problem. It attacks everywhere at once. It can cause acute lung injury, damage the heart, shut down the kidneys. It can even lead to something called encephalopathy, which is just a way of saying serious, dangerous brain dysfunction. Okay, so let's pull back from the microscopic battle and look at the big picture. How does this internal war translate into a global health crisis? And really, who is being hit the hardest? The numbers are just stark. In 2017 alone, an estimated 49 million cases worldwide. But this last number is the one that really gets me. A staggering 85% of all those cases and all those deaths happened in lower-income, resource-limited countries. That points to a massive, heartbreaking inequality in global healthcare. So who's most at risk? Well, sepsis tends to hit the most vulnerable among us. We're talking about the very young and the very old. It also preys on people with chronic illnesses, things like diabetes or cancer, and really anyone with a weakened immune system. But critically, it's also about things we might take for granted, like access to good healthcare and even basic sanitation. Those are huge risk factors. And that's because the risk isn't simple. It's not just about your personal health. It's this complex web of interconnected factors. You have to consider how nasty the bug is, sure, but you also have to look at the local healthcare system and even bigger societal issues like poverty or lack of health education. It all plays a part. Which brings us right to the front lines, the race against time. For doctors and nurses in the ER or ICU, sepsis is this incredible high-stakes challenge where every single minute literally counts. So why is it so tough to nail down? Well, for one, sepsis is a master of disguise. The symptoms, fever, confusion, low blood pressure, they can look like a dozen other things, from heart failure to a bad allergic reaction. On top of that, a lot of the time, doctors can't even find the specific bug that started the fire. And if a patient already has chronic health problems, it's really hard to know if organ damage is brand new or if it was there before. And all of this creates a huge dilemma for doctors. I mean, think about it. If a patient is in full-blown septic shock, you have to get powerful antibiotics into them within an hour. The clock is ticking. But for a patient who's less sick, where the diagnosis isn't a sure thing, giving those same antibiotics too early could contribute to antibiotic resistance. It's this constant, high-stakes balancing act. So once sepsis is the likely culprit, the game plan really comes down to three core things. First, you have to control the infection. That means getting the right antibiotics on board fast and dealing with the source, like draining an abscess. Second, you have to support the organs that are failing. That means lots of IV fluids, special medications called vasopressors to keep blood pressure up, maybe even a ventilator to help with breathing. And third, it's all about supportive care, making sure the patient gets nutrition, has stable blood sugar, all the things the body needs to keep fighting. But what happens if you do survive? What happens after the immediate crisis has passed? Let's talk about the long road ahead for survivors and where the future of fighting sepsis is headed. Yeah, surviving sepsis is often just the beginning of a whole new battle. Take a look at these numbers. Only about half of the people who survive and leave the hospital ever make a full recovery. A third of them will die within the following year. And about 1 in 6 are left with severe, permanent disabilities, either physical or cognitive. And this really highlights a huge shift in how the medical world thinks about success. For a long time, the goal was just pragmatic. Did the patient leave the hospital alive? That was the main thing. But now, thankfully, the focus is shifting to what really matters to patients and their families. We're talking about their quality of life. Can they go back to work? Can they live on their own? Those are the things that truly define recovery. So, where do we go from here? The future of sepsis care is actually pretty exciting. There's a big push for better prevention through things like vaccines and just public awareness. Researchers are working on incredible new diagnostic tests that could identify the exact bug in minutes instead of days. People are even using AI to try and personalize treatments for each patient's specific immune response. And just as important, there's a growing focus on giving survivors the long-term support they desperately need. Let's just come back to this quote for a second because it really says it all. Surviving the hospital stay doesn't mean you've recovered. The fight goes on long after the infection is gone. We're talking about physical, cognitive, and emotional battles that can last for years or even a lifetime. And that really leaves us with a huge question to think about. When we're fighting something as brutal as sepsis, is survival enough? Is the goal just to preserve a heartbeat? Or is the true challenge to actually restore a person's life? To give them back not just their body, but their future?